Some citizens say that as the world continues to grapple with COVID-19 pandemic, including Rwanda, there's an ever-increasing demand for testing to know their status. It's best to be tested and find out how one stands. We are business people and we encounter many people exchanging goods, and we don't know where they come from. We try and follow the precautions and wash our hands, but I think it's necessary I test for the virus and I know my status. I work in the field of floriculture, and it requires us to meet so many people. Testing for the virus would help me know where I stand. I know if I'm negative, and if I'm sick, then I seek treatment. On the other hand, some thousands of Rwandans who have done the test and known their status are grateful they were tested at zero cost. I was taken to Kibagabaga Hospital and I was told COVID-19 testing was free. I was tested and results came back negative, but I was told to continue being vigilant and protect myself because I meet with lots of people. I thank the government for testing us at no cost. The pandemic is serious and requires one to protect themselves and others. I was tested through a mouth swab and I was told they would send my results via SMS. The results were negative. I'm grateful that the government thinks of us, the poor, to test us and know our COVID-19 status. More than 350,000 people have been tested in Rwanda so far. The government of Rwanda has now introduced a new COVID-19 testing method known as antigen rapid tests that delivers results in not more than 30 minutes, replacing the existing one. The Rwanda Biomedical Center says that currently Rwanda has the capacity to conduct more than 5,000 COVID-19 tests in a single day, with one test costing almost $100. These tests are conducted either by nasal or mouth swabs. The Rwanda Biomedical Center says general testing is done at no cost, especially in high-risk zones where people are most vulnerable to the pandemic. It is while Rwandan citizens who wish to test voluntarily or for the purpose of travel are required to pay $50 or 47,200 Rwanda francs. Dr. Sabe Nsanzimana, the Director General of the Rwanda Biomedical Center, says free tests done for citizens should encourage the people to treat the pandemic with due seriousness. The laboratories we have across the country are as a result of the decisions being taken, and they represent the numbers of cases. Some citizens are concerned and they try to follow all precautionary measures. We need to change our behavior and the seriousness of this pandemic. Currently, we test over 5,000 people a day, while in marketplaces, we take about 300 test samples and usually about 20 or more return positive in a day. Dr. Matsidiso Moweti, the Regional Director of World Health Organization Africa, recently announced that Rwanda is among the countries that are doing well in the COVID-19 testing, saying the more a country increases the capacity for testing, the better chances it has in fighting the pandemic, because then the country knows where it stands with the virus.
One of the constant and concerning challenges in many African countries is a shortage of kits to test people for COVID-19. At the same time, some countries have increased their testing per capita while maintaining a low positivity rate, countries such as Mauritius, Rwanda, Cabo Verde, and Botswana. Through the UN Supply Portal, we are supporting countries to replenish test kits and other commodities. This area of access to new technologies, including also future vaccines and treatments, is one in which international solidarity remains absolutely vital.
The World Health Organization says testing COVID-19 is still a challenge in many countries around the world. There are times when the cost of testing is so high that not everyone can meet it, while the World Health Organization says testing is a robust method that helps determine the status of infections and how to deal with the pandemic. Health research centers around the world continue to work day and night to see that a vaccine is made available. Currently, more than 150 vaccines are being tested. Among these, 6 of them have already passed phase 2, while 3 of them has passed phase 3, which is the last phase.